All right, good evening, everyone. Welcome to yet another journal club. It is October 1st. Teresa, our fearless leader, take it away.
All right, thanks, Jahan. Good evening and welcome to Physicians Research Center's Cerium Journal Club. As Jahan said, I'm Teresa Simon, the CEO of PRC Plus. Next slide, please. Cerium is our education program and one pillar of PRC. It's designed for the busy. What's happening to my computer? I lost everyone. All right. It's Okay, the right slide is up. It's one pillar of PRC and is designed for the busy healthcare provider who wants to understand cannabis and its derivatives through the lens of science. Next slide, please. We want to thank you for taking the time to join us today and what Cerium can offer. So we're asking if you could take a minute to scan the QR code and participate in our quest to continually understand the healthcare provider we service and improve our programs. I know that Jahan has a few other questionnaires throughout the journal club, but this would be greatly appreciated if you just took a moment. Next slide, Jahan. In support of our three pillars, we also have something called Buds Info Analytics. And this is a QR code that brings you to our adverse effects data collection form. We ask that you can print it, you can share it with your patients or anyone who's tried or uses any CBD product, hemp, cannabis. We appreciate the distribution of this. You can check out our website if you want to learn more at prc-trials-plus.com. Next slide. All right, joining me this evening is Dr. Phil Molloy, a rheumatologist who's recently retired from clinical practice in Massachusetts, however, remains very active in caring for patients. And many of you may know Dr. Jahan Marcu, a cannabinoid researcher who's worked in the cannabis area for almost 20 years. I'm going to hand it over to both of them for this evening's topic of cannabis and pregnancy. It's our final of a three-part series. I think Dr. Marcu has a few announcements before we begin. Jahan?
Great, thank you, Teresa. So just a reminder about this journal club is our mission is to support the education of healthcare professionals with discussions of published research, and we approach each paper with consistency, fairness, and as much transparency as you can tolerate. And with that, we would like to just do a quick poll about topics you would like to have. We have just spent the last 3 months discussing pregnancy and cannabis, from talking about everything from prenatal exposure to early developmental research to what we're talking about now is these maternal warning signs, or sorry, mandatory warning signs about pregnancy and cannabis use. So please, if you have a moment and you're not driving, thou shalt not participate in the journal club and drive. If you could just fill out what you might like to see, for our next three journal clubs, would you like to see, for the next 3 months, one journal club a month on a topic, a different topic each month? We were thinking of doing 3 months of THC and CBD combinations and just talking about 3 clinical studies that are just about the effects of THC and CBD and when you combine them. I know some people are just interested in whatever is current, whatever is floating around there. I see we have some people surprised, and also you can leave just some text there for what you might like to see. So if you have access to your tablet or computer, please just take a moment. We'll leave it open for another minute. There's no right or wrong answer. Don't worry about that. Although it would help my ego if you liked my idea. So we will just continue. All right, cool. We got some responses here. Excellent. And we'll close the polling in about 10 seconds. So any last minute changes, I think it's multiple choice for what you can put in. So if you want to choose more than one thing, go ahead. Thank you so much. We're just gonna end the poll, and we're gonna, it looks like a lot of people like a different topic every month. So we're gonna we're gonna move on, and we can, if we want to come back to that data, we will. We're doing letting you know, we're doing another webinar with a group called Mother to Baby on October 23rd, 2:30 p.m. Eastern. They'll be putting out some press releases or announcements, but you can check the Mother to Baby website for more information. I'm told I'm supposed to let people know that I have a textbook out, covers a range of topics related to the broader public health, business, and research challenges in this area. And if you're at the Society of Cannabis Clinicians Conference on October 12th, I'll see you there. So today, my colleague, Dr. Phil Molloy, and I are going to lead a discussion about a research article entitled Association of Mandatory Warning Signs for Cannabis Use During Pregnancy with Cannabis Use Beliefs and Behavior. A fascinating study asking if, these mandatory signs, do they change behavior? Do they influence knowledge and attitudes? And so we can dive right in. And Dr. Molloy, before he takes over, he had a little bit of a polar quiz he wanted to run about this topic. So who knew you guys would be interacting with us? So here are some of our questions for you as a healthcare professional. Again, these are anonymous. We will share the results just for discussion, but again, there's no right or wrong answer here. So we ask, my patients trust me as a source of information about benefits and risks of cannabis in pregnancy. True, false, how do you feel today about it? Not how you felt yesterday, not how you feel tomorrow, but just how you feel tomorrow or right now. Great, I see answers coming in, fantastic. So, there's some like, true or false. My goal as a healthcare provider is to change my patients' behavior and discourage them from using cannabis in pregnancy. My goal is to educate my patients about cannabis use and support their decisions. So we're seeing some participants. All right, we'll leave it open for just 30 more seconds. I see most people have responded. There's a few that maybe they're on a phone or something that doesn't let them respond. I don't know. Haha, we got a few more. Thank you so much. We appreciate it. This helps guides our discussion on the data, and I think it's always important to check in. All right, we have a C plus. 77% have participated. That's good enough. We'll end the poll, and let's just share those results real quick. So as you can see, a majority of us say yes, my patients trust me as a source of information about the benefits and risks of cannabis in pregnancy. We start to see a little bit of a split here. About 29% say that I'm aware that many pregnant women use cannabis for various reasons. Some are aware. Most pregnant women get information about cannabis from HCP. 86% of respondents say false. Warning signs in dispensaries have been shown to impact knowledge and behavior. Okay, here we have it's pretty evenly split. 40% say true, 60% say false. It may come down to a lot of interesting factors on whether or not this is true or false. And my goal as an HCP is to change my patients' behavior and discourage them from using cannabis in pregnancy. 100% responded said false, and everyone said, yes, my goal is to educate my patients and support their decision. 5 out of 5. Unless you have a comment, Phil, I'll hand it over to you to start our discussion in the data.
No, they're meant to be provocative, those questions.
Yeah, they're excellent
Right.
questions. Stop sharing and all right, so Dr. Molloy, tell us about this issue and what's known about it.
Well, here are some of the facts that we know there. The abbreviation PCE that you'll see in the literature, prenatal cannabis exposure. There are other variations, but that's the abbreviation that is used most often that we'll use on our slides. It's increasing. It's increasing, especially in young people. Pregnant women use cannabis frequently for medical reasons to address symptoms that are causing distress, that are interfering with their enjoyment of life and enjoyment of their pregnancy, addressing symptoms. Some women continue to use it recreationally, but the most common reason that pregnant women take cannabis is to address a problem. And many women choose cannabis because they're under the impression that it's probably safer than prescription medicines that you read all the warnings about on the label. So next slide, Jahan. That's background information for everyone that you know that already. Over the past decade or two, everyone knows that products, despite more regulation, are becoming more and more potent in terms of THC concentrations. THC and other cannabinoids cross the placenta easily. The endocannabinoid system, you should say, is present in all reproductive tissues. Basically, every event that's related to pregnancy expresses, every tissue that's related to pregnancy expresses cannabinoid receptors. And the bottom ones, the bottom paragraph with no bullet in front of it, summarizes what we have done in August and September in our Cerium Journal Clubs. Tonight is part 3 on a 3-part, once a month series on topics related to pregnancy. The August one addressed so-called traditional pregnancy outcomes like APGAR scores, transfers of the kid to the neonatal ICU, premature birth, small for gestational age, so-called traditional pregnancy outcomes. That was in August. We reviewed that, and there's the reference in small print, Dr. Jamie Lowe from Portland, Oregon. The September one looked at a long-term, a very interesting database from the ABCD study where very large numbers of pregnant women were followed and their offspring were followed for up to 10 years, even more than 10 years, to see if cannabis users had any long-term sequelae in their offspring, such as behavioral or neurocognitive issues. That was methodological issues in all these studies, of course, but those are the previous 2. Tonight is one on what do pregnant women listen to, believe, and trust for messaging. That's the purpose of tonight's Journal Club. So next one. These are self-explanatory, worth emphasizing. If we convincingly demonstrate an association, like cannabis use is associated with certain outcome, it does not prove causation. It's very difficult to prove causation. Lack of comparisons of cannabis and cannabinoids to other medicines for distressing symptoms. In other words, let's take pain or sleep or anxiety that occurs during pregnancy. I'm not aware of any study that compares a group of women who used a cannabis-based product to a traditional prescription medicine. Women want to know, is it safer than the prescription alternative? And there are no head-to-head comparisons that I know of. It is not known how legalization impacts prenatal cannabis use. And there are postulates out there, but it's not been subject to rigorous study. I'm not sure how you would, by the way. There are methodological issues we can all appreciate, like controlling for confounding variables, other substances, smoking, background behavior, and mental health diseases, and so forth. And I think everyone on this audience knows that ACOG and the Surgeon General both have issued strong warnings in 2017 and in 2018, even though most healthcare providers that I know, my colleagues, are not aware of those 2 documents. Next. To the patients unaware. Pregnant women have been shown to underreport their cannabis use substantially, and they don't proactively address it. So this is not a novice audience, I know, but if you're talking to your colleagues with less experience than you, passively waiting for your patients to bring this up that doesn't make sense, because patients don't. Patients are afraid they're going to get reported to child services or this or that, or they don't want it written in their record and whatever. We've all crossed that. Adolescent teen alcohol use is going down quite a bit in the past couple of decades. I think maybe the messaging that started with the Surgeon General 2 decades ago Took 2 decades for that to have an impact, but it looks like it does. During the same time, alcohol use was going down, cannabis use in pregnancy was going up. And many pregnant women are not worried about it during routine visits. And when they are identified, most women do not recall receiving advice from their healthcare providers that cannabis may entail risks. Most women don't recall that conversation. Go ahead. So the underlying assumption in choosing this topic for tonight is that it's possible that cannabis use in the pregnancy environment may carry benefits to some people and it may carry risks. That's the hypothesis that we are throwing on the table tonight. What does it mean for healthcare providers? Do we address this, the knowns and the unknowns, and attempt to educate them, or just keep our mouth shut and cross our fingers and not write anything in the record, which is the easy way out that I do sometimes. I am not an obstetrician and I don't practice in the heat of pregnancy, for sure. I'm a rheumatologist. And what is our goal? I mean, this is a good time to pause and say, is our goal, this is question 5 and 6 in the poll, to educate our patients or to change their behavior? And I suppose it all depends on your personal beliefs on this. If you are convinced that there's a good story or high probability of risk, maybe your goal is to change behavior. If your goal is to simply educate women, support them in their decision, make sure that they know what we know and what we don't know right now. So those are 2 strategies for healthcare providers. Get patients to stop using if they're pregnant, which is a common message that's out there, or educate your patients and help them, guide them to enable them to make their own decisions and then support them. Just calling that to your attention. So this study is based at UCSF. There are some of the facts about it. Large number of pregnant or recently pregnant women. There's when it was conducted between May 23rd and June of 2022. This group of women were divided up into those who were exposed to cannabis warning signs. The question being asked by the study is, what do pregnant women see? What do they recall seeing? What do they believe? What do they trust about these warning signs? First of all, who's seen them? And it's a dichotomous, either yes or no, they have seen them. And it was measured in 2 ways. The first way is living in a state with mandatory warning signs. And the second is the woman says, I saw a sign. So the women are queried directly. And the outcome measures, so those are the input variables, the outcome conclusions that are being analyzed are beliefs about cannabis use during pregnancy, PCE, and warning signs. Do you believe that use is safe? Do you believe that you're being stigmatized? Do you think pregnant women should be punished for using cannabis? And we'll talk about message fatigue, which is an important topic in a subsequent slide. So that's how this is how the study was done. Go ahead. Here's who was studied. In states with recreational legal cannabis, average age 32, the majority of women were childbearing age, of course, because that's who was enrolled in this study. The majority had recently given birth, some were still pregnant. They were divided into 3 groups in the bullet number 3 there, divided into 3 groups. Those that never used cannabis, those that were regular cannabis users and quit when they found out that they were pregnant, and those that were regular cannabis users and when they found out they were pregnant, continued to use. So those are the 3 groups being compared. that's enough on this slide, I think. So the next figure, figure 1 and figure 2, I think we should, I'll make a comment, kind of busy slides, and I'll just go through how it's set up, and we'll leave the slide up for you to digest for a minute. There are 2 slides that look something like this, and then there are 2 figures after that, where all the results of the studies are. So there are 4 boxes here, and the patients were asked, warning signs scare people too much, warning signs give people important information, warning signs stop people from using cannabis. Do you believe that? And I trust the information and warning signs. So let's focus on C and D because those are really interesting. Warning signs stop people from using cannabis. As you could predict, the set of bars in box C on the right, those that are continuing to use during pregnancy, most disagree with it. Well, that group, it's not surprising. The group that is going to continue to use during pregnancy disagrees with the statement that signs are making women stop. So that's there's a lot of information in these slides, and I trust the information in these slides. First of all, strongly disagree and disagree. The red, and I don't think you can see my pointer, but you can see Jahan's. So in box in box D, I trust the warning signs. I think the most interesting thing is that the red and the mustard colored, the people that strongly disagree or just disagree are higher and those that continue to use. This is more descriptive. And to me, there's nothing that's surprising on this. What do you think, Jahan? Anything surprise you?
Yeah, I guess some of it is not surprising, and I think with my, research I've done with colleagues on just education in general, is that if people have friends who use cannabis and they're not seeing the side effects that they're talking about, if they're not experiencing them, or perhaps maybe their parent used cannabis and when they were pregnant with them and they don't,
Yeah,
they don't feel like they have suffered from that, they may not
right,
believe it as much.
right.
And I think with the sign thing, you know, we're not talking about going to a grocery store in most cases and, like having a reminder there, hey, to eat healthy, hey, to do this. You're going into a specialized store that you had to look up and find. There's lots of sort of barriers to entry to get into your typical dispensary. It's not like, there's people walking around with sandwich boards ringing bells. Most states you can't really advertise. So they're going in there for a specific purpose. And just having a general warning sign, it's like, I don't know, going on a tour of an M&M factory and a big sign says, don't eat M&Ms, they're bad for you. Versus, I'd be interested to see what if signage like saying, hey, don't smoke or use a low THC product, if that might be more effective in changing things. But I guess one thing I would see too is with a lot of the neither agree nor disagree, to me that shows there's room to move on this issue. There's room to change opinion. I'd rather see people agree or disagree than say they neither agree nor disagree. Like
Yeah.
so for me, I feel like there is some room to move here with education.
All right, let's look at figure 2 on the next slide. So figure 2 is a little bit different than I think these signs that trying to scare people or they help people stop. So figure 2, you can read the 4 boxes here and the same 3 categories of patients: those who are not users, those who have used but then quit, and those that have used and continue to use. I have heard more than enough. So that's message fatigue. B, I am tired of hearing how cannabis is bad for the baby's health. So, so in B, what I notice is that the people who never used, if you look at the red bars, strongly disagreed with this. Then maybe that's why they're not using, because they have believed this to begin with. The ones that used and quit have a moderate level of disagreement with that, and the ones that are still using, the red bar, have the lowest agreement with that. Not surprising. And they strongly agree, strongly agree, obviously, is the complementary height bar from that. People don't worry, box C, people don't worry enough about possible harms from cannabis use during pregnancy. And box C, it is easy to find information about the health effects of cannabis during pregnancy. The three groups look more similar than different in that. I'll leave this up a little bit. The rest, so that we've gone through figure 1 and figure 2. And now we have table 1 and table 2, which are the last of the results of this study. So let's just go right to this table.
And just letting everyone know, towards the end of this, we're happy to go back to these figures and discuss them, but
Yeah.
we want to get through this as well. So if you have a question, you can't wait, just throw it into the chat. But again, we'll open this up for discussion as well. So start thinking. All right.
Yeah, and you hopefully have printed a copy up of this. I have it saved digitally on your laptop there. So, so table 2, this is called table 2. Table 1 was just the demographics on entry. Basically show that there's very little statistically significant. Just to walk you through, in the parentheses, if it crosses 0, it's not a significant signal. So if you look at use before on MWS under B above, cannabis policy, the middle row, use before but not during pregnancy. All right, the first result is minus 0.06, and it goes from minus 0.37 to positive 0.24. Crosses 0, not a significant signal. Go over to perceived community stigma. It crosses 0, no significant signal. Go to the support for punishment. Crosses 0, no significant signal. So these metrics in the 3 columns, there is no signal in this group. And in the group above, so there are very few, by the way, there are very few associations that have any statistical significance. The first one, MWS cannabis policy with a B, a superscript, use during pregnancy, the women who continued to use believed that it wasn't safe. Now, to me, that's a paradox. I would have predicted something different. It doesn't cross 0, so that is a significant association. The women who are continuing to use it, despite the signs, believe that it is not safe. So there's one finding that was a statistical association and sort of a surprise. Now the C below this, MWS cannabis signs, what do I say there? There are only very, it was a similar thing. There was only one use before but not during pregnancy. So the ones that quit, so in this one, when the ones that were exposed to signs, that was a significant. So this is the first column in the middle row under this. It was significant. So women who used but then stopped when they found out they were pregnant did believe that cannabis use was not safe. Presumably that's why they stopped. So sort of describing the impact of those signs on the person's behavior. I gotta admit to the audience here, I had to look at this table over and over again before I knew how to navigate it and see what the messages were in it. And let's go to table 3 just to finish that, Jahan. So table 3, the last of the results, basically living in a state. Basically what this shows is that living, so these are different numbers in this analysis. If it crosses 1, it's not significant as an association. And basically, they all cross 1 with the possible exception of a borderline one of the full sample there. But the conclusion of this, the data in this table, is basically that if you live in a state, certainly with a policy that requires mandatory warnings, that's what the top few lines are going across. That's what the superscript A means. If you live in a state with mandatory warning signs, there is no evidence that the state's legislating mandatory warning sign has affected behavior in any way. And in the full sample, there's a borderline finding on the presence of the sign. So the first A means the state passed a law, and B means the patient saw a sign.
Well, I
So
wanted
let's,
to jump in. Teresa's the epidemiologist. I just want to pause. How did Phil do with the stats here? Do you want to clarify a little bit, maybe?
Yeah, no. I mean, I think there are odds ratios, and he did a great job in presenting them. So for the audience, as Phil commented on, if anything is over 1, I mean, it shows an increase in risk, or an increase in that side, but it's not statistically significant. And the confidence intervals are pretty wide, especially on the full sample with the cannabis policy of 0.22 to 5.67. That's a pretty wide confidence interval. But when you look at the full sample for the cannabis signs at the individual, tighter confidence intervals, and it's just over the 1. So I mean, it's statistically significant, but I mean, it's always arguable, right? That could be noise. But yeah, so Phil did a great job.
okay. The subsequent slides try to highlight the findings and put it into perspective. So the strengths, it's a large, well-done study by a great group of researchers. The representative populations, 2 measures of exposures, living in a mandatory state with warning signs, and saying you saw a sign. The weaknesses, I like the weakness of they're self-selected. Once you walk in the door of a dispensary, you've selected yourself as being someone who's probably going to buy the product, even if you're pregnant. So you've already made up your mind, I think, before you saw a sign. So yeah, we'll just go ahead from here, Jahan.
Yeah, I would just say one other weakness that I thought was interesting was the policy timing misalignment is, you know, um, there's a bit of recall here that people have to recall, and were the mandatory signs implemented at the time that they were pregnant? And so there might have been, regulations get updated. And so,
Yeah,
I think one thing we have to wonder about is in this population of people who live in states that, didn't see the signs, were they, did they get mandated at a later date, or there might be some misalignment there. I thought it was interesting that they even talked about that in the paper.
yeah.
Right, and how consistent was the signage, right? What's the
You have
message?
no idea what
Right.
signs people saw. I threw one in earlier, like a general kind of almost tobacco style warning, and we
Right.
do have some other ones that we found, including one from Washington State, to share, but we don't know what people were exposed to. Um, some more of the outcomes, Dr. Molloy.
Um, this is, I think I've alluded to some of this already, especially the bottom bullet. Women, by the time they're walking in the store of a dispensary, they've already made up their mind, independent of any sign they're going to see, notice or not notice.
Yep.
Perinatal, peripartum cannabis use, living in a state with mandatory warning signs was associated with a belief among the users only, that using cannabis was safe and should not be punished. So the users said, it's probably safe and I shouldn't be punished for using this. That's not surprising. In contrast, patients who, pregnant, I call them patients, pregnant women who were not cannabis users, and lived in a state with mandatory warning signs, did believe that cannabis should be punished and should be stigmatized. So the non-users wanted to punish and stigmatize, and the users didn't. So that was interesting. So we'll go to the next.
I thought this
Message.
was
So Phil, one
interesting.
comment. So Phil, sorry, one comment on the previous slide, Jahan.
Yes.
Sorry about that. And the comment is that, you know, it would be interesting to know if they tested any other differences between these groups, right? And what I mean by that is age. Was there some association with age? Was a younger group more, or an older group more prone to think that it should be punished? Was there some, something? Sometimes when they do factor analyses, they can determine what factors may be contributing to the results. So did they do it? Did they comment in the discussion at all?
No, I saw it in the who was in the study, but the results were not broken down by, like below age 20, 20 to 25, 25 to 30, 30.
Yeah.
I didn't see any of that.
Okay.
Yeah. So what do you think about the message fatigue? And you like this, Jahan, I know.
I think it's a common theme. There's been studies about labeling, and people just at some point tune out when there is, an encyclopedic reference on their product. They want to know, what are like the big three things? How much is in here? What's it going to do? And how long is it going to last? And that's generally, so I think that this isn't surprising to me that, um, you know, that there is a bit of fatigue
Yeah.
with this in certain groups, and I think it has to do with the type of messaging. Like, hey, we get it. Anything can be harmful. Caffeine use can be harmful. Watching stressful movies might, raise stress hormones. So I think we're at a stage where a lot of people want more practical advice. Well, okay, I'm going to engage in this behavior. How can I wear a bungee cord in a hard hat? Like, what are the precautions I can take here and still use this? How can I make this push this towards a good factor? And I think that's why people get message fatigue. It's like, yes, yes, and you only want to see Dare's lion show up and tell you not to use drugs. I don't know if you guys are familiar with various anti-drug mascots, but the even kids get fatigued of
Yeah.
those mascots as well. So I think it's a very common thing. So I think we have to get a little bit more clever and nuanced with the messaging, and we're starting to have more and more data on our side. So I
Yeah.
was not. This was the least surprising thing for me
Well,
from the study,
the
but I'm
middle
glad they
bullet,
measured it.
yeah, the middle bullet makes me wonder if the legislatures who are making these rules are aware of this.
I
That
think that it's a politically sound decision. We'll put a warning sign, slap a warning sign on that, and you're fine.
yeah,
So maybe it's the state's way of kind of putting a disclaimer on the
yeah.
product.
And
But
the last bullet talks about a possible negative sequelae of these mandatory warning signs, greater stigma, more support for punishment. Is associated with those signs. So they might do harm, and they don't do any good.
right, and I think if people don't trust the messenger,
Yeah,
that could also be an issue. So I think it's depending where the
yeah,
message is coming from.
yeah. Okay, the next.
And so this is some of the signs I found. I actually found on the left here, this is actually about the study we're discussing. Someone made a little leaflet. This one here, which has kind of just all bad news, is from the Orange Coast Women's Medical Group. And then I found this on Washington's State Liquor and Control Board, which I thought was a little bit more rational and kind of balanced. Like, if you're risk adverse, here's one, one more thing to avoid. But again, I think so we probably could anticipate that maybe a dispensary might print this out right from Washington State Liquor and Control Board and put that up in the dispensary. But again, we don't know how many people were from Washington State enrolled in this.
Yeah,
But it would be great. I guess that could be another study, is looking at signage and having people rate the signage and what they think. They've done similar things with looking
yeah.
at the universal symbol for products containing THC.
Washington was one of the states in this study.
Yeah.
Yeah.
Um,
Okay.
what else do we got here? Oh, so, all right, you've waited for this all night, uh, participants. What do you think of the study and its conclusions? Um, if you want to, you could raise your hand. I dare say even unmute yourself. We can call on you. You can put a question into the chat. Um, and we'll be happy to engage on the topic. We do have a more extra information if you're interested as well, but I'll give you all a minute to let it percolate.
And we have another tempting slide, a sentence to finish.
All right, so we'll let it percolate, but feel free to jump in as we go, kind of just through the next one or two things. Um, Phil, you pulled this quote right from the paper, and again, participants, just want to say you can throw a question into the chat. You can unmute your mic and interrupt us. We want to open it up to any questions you may have. But Phil, go ahead.
Yeah, just read it. It's worth noting that among users, exposure to warning signs was associated with believing that the use was safe and should not be punished, the opposite of the hypothesis of these researchers when they started.
I
And the
guess
next is a,
I would say I guess it's a good sign that you can't just put up a sign and everyone will believe it. So maybe that's a
yeah,
good sign
it is a
that
good
people
thing.
think critically.
And then
Yeah.
we went over this already. Signs, mandatory warning signs are not associated with decreased use. And
Yeah,
yeah,
I think that we've seen this from even some very aggressive anti-drug messaging that
right.
that there was increased chances of exposure after being exposed to
Yeah,
certain messaging. So this is kind of confirming that there
yeah,
should be some formative efforts in this messaging versus just let's just roll out a message and
yeah.
stigmatize people. So here's a fun little opportunity. Maybe you could fill in the blank if you'd like. Healthcare providers should. I'm not sure how to finish it. If I'm sure Phil, who's been talking a lot tonight.
Well, um, personally, I mean, I focus on educating my patients and being non-judgmental. Uh, just throw,
Yes, Mark, Dr. Viner, please, please unmute yourself and hop into the
Uh,
discussion.
Hi, hi. The message, I guess they have to kind of put something. I understand that, but I find a lot of the message is always negative and punitive towards the patient, like in different states, the ones I've studied. And instead of saying, "Oh my God, you've got to stop it. You're pregnant. This is gonna the pregnancy is a very inflammatory state for some women and anti and pro-inflammatory. There's just a lot going on. So, there might be some reasoning, there's some good studies should be done to see, if it could actually help some people during pregnancy. So, and in fact, what if stopping it makes the girl have a pro-inflammatory rebound and harms and could mess up the baby at some phase or after delivery? None of these address the highest time of substance use in pregnancy, which is in the postpartum period. So would you rather have a postpartum suicidal, infanticidal patient without her cannabis, or maybe the little bit helps her deal with so anyway, they're way too negative in my view. It's a start, but in general, I find them negative, punitive, and they should say you must talk to your doctor right away and get some advice, not just automatically stop it right now. Anyway, thank you.
No, thank you, Mark. I really like that because, with a lot of substances, even caffeine, the body adapts to that, develops tolerance from that, and there will be the body, may not like it if you suddenly stop something that it thinks is normal and has developed a response to it. I mean, we see that with, in animal studies, and things like that. Just speaking as a more of a basic researcher, but Dr. Malloy, I thought it was an interesting point about
Yeah,
if they're already using it, um,
yeah,
stopping it completely could swing the pendulum in an unknown way.
I'm with you.
Yeah, that's great comment there, Mark. I appreciate that. We got a comment from Alicia as well, is that healthcare providers should be objective as much as possible and provide as much education as the research can show. I like that as well, is objective is almost like be open to the discussion and not just shut down. So I think that's great.
Yeah,
And and well, we'll in the interest of time, we'll keep moving. If and again, feel free to comment as well. But Phil found, as many of you probably know as well, Dr. Molloy also just wanted to share a couple other references. This is online as well. We'll be posting this video. So if you look for the Cerium Journal Clubs on YouTube, you should be able to find them. But again, there's a lot of areas here looking at online marketing, reasons people use it to self-treat, and perspectives of different age groups on cannabis and pregnancy. And there's even more on this topic. Um, I do remember the healthcare professionals and bud tenders' perception of perinatal cannabis use. That was a very interesting one too. So this is an area of active research, and I think people are tired of being asked the same research questions and doing the same sort of study, but starting to look at more balanced approaches to this research, different ways of engaging in the subject, because you can never, as Phil, as you said, for the last 3 months, you can't enroll pregnant women in a study and have them take a drug. Like those studies really aren't approved. So our best bet is for observational studies, is for surveys,
right.
and really making people feel comfortable talking about it. And let's see, where else are we going with this? Well, this is one of your slides, yeah?
Yeah, I think this is all pretty obvious.
Oops.
So this is, yeah, we can, what other studies or research is needed? I just want to echo Jahan. There will never be a randomized prospective control study taking pregnant women and randomizing them to cannabis and no cannabis. That's not going to ever happen.
Yeah, and so I think that there's a role for all the stakeholders in the society and in professions. I think dispensaries could, and even cannabis, licensed operators could help a lot with education as a point of engagement for studies as well.
Yeah,
So it'd be interesting as well to see industry participate more and more in, again, we're trying to do an objective study here, not try to stigmatize people. So it'd be great to get more involvement with additional communities. So just want to remind everyone that we do have free memberships at Cerium. It's just an email and you make a password. No other information is asked. And you can see things like our blogs and I believe events like this as well that you can participate in, or just continue to look for them on LinkedIn or wherever you find out about the Journal Club at your professional society. We are going to continue to do these November, December, January. I had proposed looking at 3 clinical studies on THC and CBD combinations. So there was one that just came out about, timing of dosing of THC and CBD. There's some on inhalation, some on oral. But it seems that we're going to review the ideas that people put forward. Some people seem to just want a different topic every month, which is fine. But Teresa, yes.
Jahan, did you get those results? Can you share them with those who are on here so we can
Oh,
see?
yes, that's a great idea. Let's go back, view results. I'll share results here. So again, if you guys have a burning question about today's paper, happy to go back to that. But again, Teresa, Phil, and I put this together to engage folks like yourself. And so getting your feedback is really important. So we see a lot of people said a different topic or article type each month. So a variety, maybe it's epidemiology, maybe it's clinical. We haven't really done a basic research paper. Some people were interested in THC and CBD combinations. No one was really interested in what is trending on social media, which is a little bit of a relief. And some people said just surprise me. And we did allow you people to choose multiple stuff. So, you know, for me, part of this is that I think that there's a lot of stuff that doesn't normally come on our radar. Many of us have customized feeds and channels that we get information, and maybe the randomness of this journal club and picking things helps expose people to different topics.
Yeah, I mean, even if there's a paper that someone on the line wants to hear what our opinion is about it, I mean, I think that that's also something that we would consider.
So we got some, we have people's emails there, just ignore that. We had other cannabinoids in the latest research. So like maybe ice, yeah, I think that's actually cool because you could talk about CBG, CBN.
THCO, THCA, I mean, like
Yeah, all
the-
that stuff.
the
Mostly
alphabet
new
soup,
clinical
right?
research, so some more clinical studies. Mental health, okay. Eating disorders, sleeping, OCD, great idea. We got more on driving under the influence, more on CBD modulating the effects of THC, best cannabinoids for different cannabinoid terpene profiles for different health conditions. So we got a little bit of a mix, but I would say one of the themes I think I am seeing with this is a variety of research types, variety of cannabinoids. So maybe not just sticking to age-old cannabis, but let's talk about maybe a specific product and really try to talk about that. So I think this is helpful.
Yeah, thank you everyone for whoever responded. So are we running over? I mean, I see people are
Yeah.
dropping off. I think we're running over.
All
Yeah.
right. Well, we will say adieu and thank you so much for hanging out with us on for the Journal Club and participating. We appreciate it.
Bye.
Thank you. Hey, Dan,
Hey.
I may have one more iteration. Don't read it yet.
Okay.
I ran into Dave Valancourt over the weekend. So he's like, if you could answer these 2 questions, that may give you a little bit more purchase. So if you haven't picked up the article, don't.
All right.
But I should see you on the 12th. So I hope to have it done by then.
All right, excellent.
Yeah. So no, thank you guys. This is great. Really appreciate your time.
Thank
Thanks.
you.
Bye guys. Have a good night.
Bye.
So it's just the three of us.